A primary care home is a new model for delivering healthcare to populations rather than at an individual practice level. So in Bassetlaw, we're developing 3 primary care homes, 2 across Worksop and 1 across Retford and the villages. So we've got GP practices coming together, working with other providers of healthcare, particularly community nurses, community therapists, but also with colleagues from the hospital, colleagues from mental health trusts, drug and alcohol workers, but also people involved in the wider, what we call the wider determinants of health.
The feedback we've had from patients so far is that they feel that things are a lot more joined together now. We've had feedback that if a GP's been to see the patient at home and the district nurse then goes in, that the district nurse knows more about the patients aren't repeating the story. They feel that services are working together a lot more, and that actually that the services that are visiting them know about them as a person rather than just as a patient.
By actually having a joint team based around the primary care home, we can have different providers of healthcare. So the traditional doctors and nurses and healthcare assistants within the practice working in an integrated way with our community nursing and community therapy colleagues. The patients should notice no barriers to their healthcare needs, but actually a team working collectively together to actually deliver it.
We've seen staff saying that they're happier at work. We've done some staff survey, we've done some patient survey, and the benefits are all around that joined up working, the services working together, people are understanding each other's job roles, people are working better together, and obviously that's better for patients when services are working together, understanding each other's role, understanding what each other does more. Across
the Retford and Villages primary care home that we're developing, we're actually working across the 6 practices involved to actually look how we can provide extended hours together. We'll be offering evening appointments every day of the week up until 8 o'clock, but also offering appointments on a weekend, both Saturdays and Sundays.
We've already seen some anecdotal evidence of the primary care home team are not using crisis response services as much, so patients seem to be more proactively managed and not getting into crisis, and that's obviously having positive impact on their health and well-being and positive impact on their care.